couple decades ago, United Way, we were involved with, of course, law enforcement and the judicial system about closing the pill mills that were here. Broward was like the highest capita of pill mills in the country. So there was kind of these doctor shops on all these different corners, and it was really people going in and getting OxyContin or oxycodone, and we helped to get those closed. However, what happened is there was a whole series of folks who were addicted to opioids due to the pill mills and going doctor shopping and getting prescriptions. And so now there wasn't that access anymore. And then folks really had to turn to alternatives than just their prescriptions. So people started to sell, there was opportunity now. So people started to make and sell heroin and then started to cut it with fentanyl. And we know that fentanyl is so lethal and so addictive that we have people in our community and throughout this country who are dying on a daily basis due to drugs that are laced with fentanyl and other synthetic drugs. So one of the things about closing these pill mills, but didn't realize that there would also be this, in a sense, a negative consequence of so many people addicted, and now where are they going to get their opioids? Addiction is a very complicated medical issue. People think someone that's addicted to drugs or alcohol, that it's a moral failing, or that they should just say, oh, no thanks, oh no, this is not good for me, I shouldn't do this anymore. It is not that simple. I want people to know that addiction is a medical issue. It is a chemical imbalance that happens for some people. It doesn't happen for all people. So if you listening to this and you don't have addiction issues, you should be grateful, because people that do have that propensity for addiction, I just call it the addiction chip. Somebody can sometimes take one opioid because they've had an operation and they literally, all their cells, all their system in their body changes because they instantly become addicted to that. Some people become addicted over time, whether it's to drugs or alcohol. Folks that have addiction issues, they cannot be social drinkers or social marijuana users or social pain medicine users. And our system is not set up for the true treatment of folks that have addiction issues. We know that insurance will pay for people to go to treatment or to mental health care, but they pay for 28 days. 28 days is barely enough time to get the fog out of your system before you can actually start to really think about recovery and how are you going to move forward without this drug or this alcohol or whatever your addiction was. And how do you become like a normal citizen but not using at that point? It would be like telling somebody, all right, you can't breathe anymore, you can't eat anymore, that's just off the table for you. I mean, that just can't happen. It's very, very difficult. And our system is not sensitive to people with addiction issues. If I come into you and I say I'm a diabetic, you're going to do some testing and we're going to talk about it, and I'm going to be on diabetic medicine, and I really have to change my diet, and I have to take my medicine, and I have to see my doc, and you're going to be sympathetic to me, and you're going to work with me, and I'm going to share with my friends and my family that I have diabetes or heart disease or something. If you're an addict, you don't get that same type of collaborative care. You don't get empathy. You don't get, oh my goodness, I'm so sorry that you have this. It's the same thing. It is a medical issue, and we have to start to treat this, that this is a health issue that they battle and that they fight with, and that they need all the support that we can have. Medical support, psychological support, funding, insurance to pay for more than 28 days of treatment. So at United Way, we have something here we call the Commission on Behavioral Health and Drug Prevention. And it's part of our health pillar, because having a healthy mind, a healthy body, a healthy psyche is all important. And we want to normalize addiction and people that have addiction issues. So we have about 100 folks who sit on the commission from all different avenues, walks of life, people who are formerly addicted, parents who have lost people to fentanyl overdose. We have the medical examiner, the sheriff's department, the Broward Health, Memorial Health. We have nonprofits. We have elected officials. We have an enormous amount of folks who sit on our commission. And we break that commission up into 7 action teams. And one of those action teams are called the Community Response Team. And that is in response to the opioid epidemic here in our community. So we have folks who chair, who vice chair. We put together an opioid action plan for the entire community. The plan that we're in right now is from 2022 to 2025. And it lists all the tactics and the strategies of how we are trying to fight this opioid epidemic and prevent it from happening and preventing people from, 1, getting addicted, 2, from people buying drugs that are laced and synthetic, and then 3, of course, really moving forward the prevention method and the prevention story here in our community. And one of the programs that we fund here and we work with our community on is being present in the emergency rooms. So often people might take a dose and the EMTs come out. Our firefighters and our medics are amazing. So they all have Narcan. They're all equipped with that. So they come out to a scene, they can revive somebody right on the spot, and they obviously bring them to the emergency room. So we want to make sure that we have a prevention specialist at that emergency room within 30 minutes of someone being taken there on an overdose. Because when somebody is at their lowest, when they've overdosed but not died, thank goodness, you want to start now to talk to them about treatment, right? If you wait to the next morning or the next day, they start feeling better, so they start saying, no, I'm good, I understand, I'm going to go to treatment, I'm going to do this. So you have to get people when they really do feel their lowest. That we want to be able to see them experience what they're experiencing, show them that there is definitely help that they can have. There's plenty of treatment centers here. There's plenty of people willing to work. There's plenty of people who have overcome their own addiction to opioids and now working with folks in our community. And if it's somebody that's not addicted, we want to make sure that they don't ever take another pill again from a friend, from a colleague, off the internet, ordering it from somewhere, because we know for sure that one pill can kill. Everybody's journey with addiction or drug use is different. It really is. It's very individualized. Some people have a great deal of difficulty getting into recovery and staying clean and sober, not using again. And that's okay too. We need to be forgiving of people who relapse. We need to be okay that that is part of the journey. We should not be kicking people out of treatment because they have a relapse, or, we should be having some low barriers for folks to be able to stay in treatment even when they have a relapse. There are many treatment facilities through our nation. Some are funded through their counties or their cities, and they're low cost or no cost. Some insurance pays for, some are, that you pay on your own, but there is many avenues for people to seek treatment and to get help. There's 800 numbers, that folks can call, whether they're community. Anyone that's listening to this right now and lives anywhere can call 211. 211 is a information line and a helpline. Every 211, every area has 211. 211 can tell somebody where they can get help that day, whether they're experiencing a mental health crisis, whether they are experiencing addiction, whether they are worried about a child, a spouse, a neighbor, a coworker. 211 can guide somebody for what is available in their community to assist them, whether, again, it's treatment or even someone to talk to, somebody to discuss what they're feeling and what they're experiencing. Not everybody needs treatment. Some people need somebody just really to talk to and for them to be listened to. So there's a great deal of resources in their community. Here at United Way, we're here to serve the community. Our mission is fighting for the health, education, and financial prosperity of everyone in our community. And under health comes that piece about addiction and behavioral health and mental wellness. We have a surveillance team, we have an epidemiologist, We want to track all the programming that we're doing and all the funding that we're doing to make sure that it's making a difference. So we track on a monthly basis, obviously a quarterly basis, an annual basis. And thank goodness opioid deaths have gone down. We work with the Sheriff's Department. We work with the Fort Lauderdale Police Department. We work with the Medical Examiner's Office. We have a team of professionals that are in the community trying to collect data on a daily basis so that we know what interventions are working, what prevention methods are really making a difference. We have a great treatment focus here in our community, but we want to start before somebody needs treatment. We want to start in the prevention area. We want to educate people as young as we can about the dangers, of drug use and what can happen and what happens to your body and your brain, and of course what can happen if you take a lethal dose where that you are really dying at the same time. So it is really, really important that a continuous message comes out into this community.
There used to be a time, not that long ago, in the treatment industry where we would diagnose someone with a substance use disorder only. It is much, much more common now for clients in treatment to be what's called dual diagnosed. So we know that they have an underlying behavioral health diagnosis, and then it may be very correlated to their substance use or misuse. So that's one big thing that has changed and will continue to change. So we're not just treating the substance use disorder, but we're also going further and understanding post-traumatic stress disorders, making sure we're understanding depression, anxiety, attention deficit disorders. All of those things are connected and tied in. So it's not like the old days where we said, oh, you have one diagnosis, you've got to stop drinking. So it's much more than that. It goes much deeper. My position, and it's an evidence-based position, is that it really takes 2 full years of treatment and recovery support for someone to eventually be able to manage their substance use disorder, because there is no cure, right? It's a disease without a cure. The only thing that we can do with a disease without a cure is to learn how to manage it. And so that's the time frame that it takes. Unfortunately, we have this treatment culture where insurance companies will pay for 28 days of treatment and then there's no follow-up, there's no support, and the person goes right back to the same environment that they were in, and no surprise to anyone, they relapse. And so that has to change. We have to start understanding that it takes a very long time, and not just a 28-day magic trip. The whole continuum of care, from somebody entering detox, then going through residential treatment, then being discharged to intensive outpatient, then being discharged to an outpatient program, and finally being discharged into aftercare. Those are the levels of treatment that, if someone went through all of those, could take very easily up to 2 years. But we also have to make sure that along the way, we're providing supportive, respectful, safe housing. So a lot of times people who are suffering from a substance use disorder should be transferred into a recovery residence where they can be surrounded by others that are also learning to manage their disease, and there's programs and initiatives that the recovery residences run to make sure the clients are employed, they're healthy, they're attending groups or treatment, that they're drug tested on a random basis, not to catch them, but to hold them accountable. So we really have 3 priorities facing our community right now as it relates to mental health and to substance use disorders. First is, we are still, unfortunately, in the midst of an opioid epidemic that is tragic and affects families and communities in ways we can't even imagine. And we spend $78 billion as a country. That's the economic impact of opioid use and misuse. So that's a real big issue for everyone, including here in Florida. Now in Florida, we're lucky that we've had a lot of innovative solutions and strategies put in place. And there is a little glimmer of good news, and that is that in Florida, up until May of 2024, the CDC's Center for Health Statistics, National Center for Health Statistics, shows that Florida is down over 12% in the previous 12-month period ending in May 24. So that tells us that a lot of things that we're doing are right and that we need to do more, because even with that decrease, we're still at over 6,800 deaths a year in Florida, and that we just can't accept that anymore. We have to be more innovative. And one of the things that has moved the needle on overdose deaths is the use of naloxone, or sometimes known as Narcan, which when someone has overdosed on opioids, they can be revived. So obviously that has impacted the final numbers and the outcomes. And a lot less people, of course, as a result, are not dying due to their overdose, whereas before that was an issue. So we have significant programs and strategies and teams that are out on the street in every way, shape, and form, making sure that Narcan gets into the right hands. We offer it here free. A lot of other agencies offer it for free. A lot of law enforcement carry it in their cars. Has had a significant impact on the overdose deaths. So the other two strategies that we're going to highlight in my coming term is going to be the issue that is or going to arise as a result of a House bill that was passed in this last session that penalizes people who are sleeping in public spaces and criminalizes that activity. And law enforcement has to figure out how they can humanely address that issue and how we can support those people that are in that situation so they're not, in addition to being without a shelter in a safe, respectful place, they're also subject to arrest, that can't be acceptable. So we have to find a solution, a long-term solution here in Broward County to focus on that. The other one is continued marijuana use and abuse by our young people. They're starting very, very early in life using marijuana with the medical marijuana prescriptions that their parents may have. They find gummies around the house that are THC laced, or they find just a little tiny bit of marijuana. We had a case the other day. We had a 3-year-old found a little bit of marijuana in between the couch cushions and ate it, and then had to go to the hospital, obviously, for an overdose situation. So those are the three biggies that I think that are hitting us right now. And obviously prevention is, for the young people, prevention in the schools as early as middle school, talking to them about how dangerous marijuana is, because it's become so normalized. And lots of people, and children of course, don't know that our brain has not fully developed until the age of 25. So use at a young age of marijuana can have a lifelong impact. The good news is that I'm inheriting a very successful commission with very active members with incredible insight, different backgrounds, and are willing to volunteer their time, effort, and energy into making sure that our community, and especially those that are underserved in our community, have access to services. United Way of Broward's Commission on Behavioral Health and Drug Prevention. There's lots of people on that board, approximately 40 people on that board, that represent all kinds of different areas of that network of support. It includes judges, doctors, law enforcement agencies. It also includes CEOs of other providers in the network. So there's a lot of collaboration that goes on that commission. And then we have some action teams that are also associated with the commission that carry out the mission. We have one on recovery, we have one on prevention, and we have one on public policy so that we can advocate specifically on those three issues. And that's all under the umbrella of the community response team, which is made up of about 60 individuals from across our community that aren't necessarily a part of the board, but they want to know how they can help, they want to know how they can be involved, and they want to bring up the issues that they see and see those things supported. So there's lots of outreach that goes on, primarily by the United Way staff. And then there are hundreds of volunteers that are also spreading the word to their friends and family and neighbors about all the different programs and the ways in which the United Way of Broward can support and can provide solutions to real everyday problems.
Here in Broward County, we have the Broward Addiction and Recovery Center. It is a center that has been established for the last 51 years here in Broward County, serving Broward's most vulnerable citizens, those citizens who've been significantly impacted by substance use or substance abuse. We have a 50-bed detoxification center as part of the Addiction Recovery Center. We have a 92-bed residential facility to support individuals challenged with substance use or substance use disorders transition along the way toward recovery and self-sufficiency. Everything from the initial assessment, someone having a concern or an issue can get assessed, and if that assessment determines that they need further intervention or further assessment, there's a detoxification process. And as we know in recovery, it's just beyond, it requires things beyond just initial 30 days. And so we also offer residential stay so individuals can continue to support their recovery. The United Way here in Broward County has been kind of a portal of connection for community services dealing with its citizens. Our Broward Addiction Recovery Center plays a vital part in the utilization of some of those services and supports that link individuals who are experiencing behavioral health and substance use disorders. And the United Way has been really impactful in making sure that substance use, substance disorder stays elevated as a vital, important aspect for Broward citizens. Here at BARC, one of the things that we do is when individuals come through the center and are served and supported, we partner with United Way as well as other providers in the community to ensure that individuals who come through this process are never left alone or they're never left isolated. They are always feeling supported. As you know, United Way focuses a lot on prevention. And so we work very closely with efforts around education and outreach around substance use, substance abuse, substance disorders. What's unique about BARC, as I call it, the Broward Addiction Recovery Center, is that it is a service that is free for Broward County citizens. It is funded by the Broward County Commission that provides all of the funding to serve individuals through their process of recovery. When I look at the current landscape of what individuals and communities are experiencing that cause them to enter into this world of addiction or significant drug usage, I think you have to look at it as a combination of the ecosystems, meaning that individuals oftentimes are experiencing a lot of trauma, they're experiencing a lot of stress as a result of some of the social determinants of health, i.e. Lack of affordable housing, i.e. the stresses of being unemployed. You also have significant issues that cause individuals to have an increased pressure and spike on their mental health. We have a significant number of individuals who show up for our services who have co-occurring issues. And when I say co-occurring, they are either struggling also with their mental health issues along with their substance use and or abuse. Oftentimes, in order to address their mental health issues, they are medicating, utilizing illicit drugs to soften the pain of trauma, the pain of loss. We live in a very rapid paced society where I really truly believe that we have lost, in some aspects, the art of I am my brother's and my sister's keeper. And so many times individuals are feeling so isolated and they are willing to try any and everything. I think also you have to look at the economics of drug usage for those who are selling, those who are distributing. We're seeing a significant increase in the use of synthetic and drugs that have been altered and that have been tampered, and many of the individuals are spiraling quicker than they perhaps would have in some of their experimental phases of drug usage. I describe our department as serving individuals from womb to tomb. We fund a significant number of behavioral health services for children, families, and adults throughout Broward County. We have a sexual assault treatment facility for individuals who have been subjected or traumatized as a result of sexual assault. We have what we call family success centers. These are centers that help support families toward their self-sufficiency. If they're struggling with their rent, or they're struggling with any other financial payments or any other issues that prevent them from being a productive citizen, whether they may need job training or et cetera. We have supports to serve individuals. And once again, always taking into mind that it's not just somebody coming in with one singular problem, a singular issue. We're looking at trying to create and heal the whole person. A couple of other things that are significantly important. We are responsible for service delivery to Broward's homeless population. Looking at how, and in fact, it'd be interesting, in these last 2 days here in South Florida, when the temperatures have dropped below or near 50, we have provided shelter and support, because while sometimes somebody might not think that 50 degrees is too cold, if you've been living out on the streets and you are struggling with your mental health and also your addiction, you are going to be in need of services and supports. We also provide elderly and veteran services. We support the elderly population here in Broward County as well as our veterans. We also, work really hard at engaging the community, elevating the fact that this is a community issue, and that while the county has its role and the county has its place in supporting these services and supports, we want to build up partnerships so that when individuals do receive services, they can thrive and survive when they return to their communities or in their current existing life. My message to them would be seconds turn into minutes, minutes turn into hours, hours turn into days, days turn into weeks, weeks turn into months. And if they were to take a look at addressing and slowing down their life, that breaking it down that way allows them to take ownership of where they need to go, what direction they need to go in, and to understand that support is available. We here at Broward County are going to continue to do our efforts in ensuring that services and supports are available for those who are in need and who are desirous of recovery. What I would just say is that we need all of us to be more compassionate to individuals who are on their journey in life. We all are only a paycheck away, a couple of paychecks away, a significant traumatic experience away, a loss away from perhaps needing these types of services that we're talking about. And so the more compassionate that we can be for each other, I think the better we're going to be able to serve and support those who are currently experiencing and those who may experience challenges in the future. Individuals who come to BARC can come for free, whether they have insurance or not. And so there is a progressive plan of action for individuals. Traditionally, 30 days is a good marker to determine people's commitment, desire, and their drive toward recovery. And then we don't just drop people off and say, you have to leave. Now is the possibility of transitioning into those residential beds, where on average people are staying anywhere from 60 to 90 days in the residential beds. And so we just believe that, along with supports, not just while they're here at BARC, but setting them up for aftercare, setting them up for outpatient services, setting them up for support groups are the vital recipe in order for them to maintain their sobriety and their ongoing recovery. Everybody has a role in this, and everybody matters, each and every one of them. Each and every individual who's experiencing these challenges matter, and they are important.
There is a stigma to identifying yourself as someone with a substance use disorder as though it might be some kind of moral failing, instead of what we know now, which is that it's a behavioral health. I'd say let's end the stigma, stop judging people, and look for ways to support them and lift them up.
We have to take care of each other. There's a lot of crisis that's happening in our country, in our world, in our communities, and we don't know what's happening in people's families. We always have to give people grace if they are having a bad day or they're angry, or we don't know what goes on in people's worlds. So we have to be that open, empathic provider for folks. We want the community to be able to rely on United Way for all that they need. So changing one life, saving one life, saves hundreds. And then if you add those up, it's hundreds of thousands, and through the country it can be millions. If we could prevent people from overdosing and dying from opioids, I mean, it saves communities.